When it comes to safe sex, most conversations focus on vaginal or anal intercourse. Oral sex, however, often gets overlooked, with many assuming it's safer or even risk-free. This is a misconception. The truth is, you can contract sexually transmitted infections, STIs, from oral sex, and the risks are more significant than many realize. Whether you're young, older, single, or in a long-term relationship, understanding these risks is crucial for maintaining your sexual health. This comprehensive guide explores the realities of STIs from oral sex, the specific infections you need to know about, their symptoms, risk factors, and practical prevention strategies. Our goal is to provide clear, shame-free information to empower you to make informed decisions about your sexual health. Part 1. The basics: what most people don't know about oral sex and STIs. What is oral sex? Oral sex involves using the mouth, lips, or tongue to stimulate a partner's genitals or anus. It includes fellatio, oral stimulation of the penis; cunnilingus, oral stimulation of the vulva; anilingus, rimming, oral stimulation of the anus. These acts are common expressions of intimacy and pleasure across all ages and relationship types. However, they involve contact with bodily fluids, saliva, semen, vaginal fluids, or skin, which can transmit STIs if one partner is infected. Can you really get STIs from oral sex? Yes, absolutely. While the risk of contracting an STI from oral sex is generally lower than from vaginal or anal sex, it's far from zero. STIs can spread through direct contact with infected skin, sores, or warts, exposure to bodily fluids like semen, vaginal fluids, or blood, mucous membranes in the mouth, throat, genitals, or anus, which are entry points for infections. The misconception that oral sex is safe stems from its lower risk profile compared to other sexual activities. But this doesn't mean it's risk-free. Many people are unaware they've been exposed until symptoms or serious complications arise. Which STIs can be transmitted through oral sex? Several STIs can be passed through oral sex. Here are the most common. Herpes simplex virus HSV types ASV1 commonly causes oral cold sores, and ASV2 typically causes genital herpes. Transmission: either type can infect the mouth or genitals via oral sex. For example, a cold sore, HSV1, can spread to a partner's genitals, or genital herpes, so SV2, can infect the mouth. Prevalence: herpes is very common. Many people carry it without symptoms. Human papillomavirus is HPV description, the most common STI globally, with over 100 strains. Some cause genital warts, while others are linked to cancers, e.g., throat, cervical, anal. Transmission spreads through skin-to-skin contact, including during oral sex, and can lead to oral or throat cancers in rare cases. Prevalence: most sexually active people contract HPV at some point, though many clear it naturally. Gonorrhea description: a bacterial infection that can infect the throat. A pharyngeal gonorrhea, genitals, or rectum. Transmission easily spread from genitals to throat or vice versa during oral sex. Concern: rising antibiotic resistance makes early detection critical. Chlamydia description: another bacterial infection, less commonly transmitted to the throat but still possible. Transmission can spread from genitals to throat or throat to genitals during oral sex. Concern: often asymptomatic, making testing essential. Syphilis description: a bacterial infection causing painless sores, chancres in the mouth, genitals, or anus. Transmission: highly contagious through contact with sores during oral sex. Concern: rates are rising, especially among older adults and men who have sex with men. HPV description: a viral infection that attacks the immune system. Transmission: lower risk through orals compared to vaginal or anal sex, but not zero, especially if there are cuts, sores, or bleeding gums. Concern: modern treatments make HIV manageable, but prevention remains key. Hepatitis A, B, and C description: viral infections affecting the liver. Transmission: hepatitis A is often spread through oral-anal contact. Rimming: Hepatitis B spreads via bodily fluids like saliva or semen. Hepatitis C is less common but possible if blood is present. Concern: vaccines exist for A and B, but not for C. How high is the risk? The risk of contracting an STI from oral sex depends on several factors. STI status: if either partner has an active infection, the risk is higher even if symptoms aren't visible. Symptoms: visible sores, warts, or discharge increase transmission risk. Oral health: cuts, sores, or bleeding gums in the mouth create entry points for infections. Protection: condoms or dental dams significantly reduce risk. Fluids: ejaculation or exposure to vaginal fluids increases risk, especially if swallowed. While the risk is lower than with unprotected vaginal or anal sex, it's significant enough that precautions are necessary. Data from the CDC shows that oral sex is a common transmission route for herpes, HPV, and gonorrhea, with thousands of cases annually linked to oral contact. Symptoms of oral STIs: one challenge with oral STIs is that they're often asymptomatic, meaning you or your partner could be infected without knowing. When symptoms do appear, they may include persistent sore throat or pain when swallowing, sores, blisters, or warts in the mouth or on the lips, swollen lymph nodes in the neck, unusual taste or smell in the mouth, flu-like symptoms of fever, fatigue, body aches, especially with syphilis or early HIV. If you notice these after unprotected oral sex, consult a healthcare provider promptly. However, because symptoms may not appear, regular testing is critical. Why this matters for everyone: STIs don't discriminate by age, gender, or relationship status. While sexual health discussions often target younger people, older adults at 50+ are increasingly at risk. CDC data shows a significant rise in STI rates among those over 55, driven by factors like increased dating after divorce or widowhood, less frequent use of condoms due to lower pregnancy concerns, lack of updated sexual health education. Sexual health is lifelong. Staying informed and proactive is essential, whether you're exploring new relationships or maintaining intimacy in a long-term partnership. Part 2. Common STIs spread through oral sex and their symptoms. Now that we've covered the basics, let's dive deeper into the specific strands. Transmissible through oral sex, their symptoms, and why they're often hard to detect. 1. Herpes simplex virus HSV details. Herpes is one of the most common STIs spread through oral sex due to its ability to transmit via skin. 2. Skin contact, even without visible sores, asymptomatic shedding. Symptoms: painful blisters or sores on the mouth, lips, or genitals. Tingling or itching before sores appear. Flu-like symptoms of fever, body aches during initial outbreaks. Silent spread. Many people with herpes are asymptomatic but can still transmit the virus. Management: antiviral medications, e.g. acyclovir, reduce outbreaks and transmission risk, but there's no cure. Example scenario: if someone with a cold sore, HSV1, performs oral sex, they can transmit the virus to their partner's genitals, causing genital herpes. Conversely, HSV2 from genital herpes can infect the mouth. 2. Human papillomavirus HPV details. HPV is the most prevalent STI worldwide, with over 80% of sexually active people contracting it at some point. While most clear the virus naturally, persistent infections can lead to serious issues. Symptoms: often none, asymptomatic. Some strains cause visible genital or oral warts. High-risk strains may lead to cancers, e.g. throat, cervical years later. Oral risk: oral sex can transmit HPV to the throat, potentially leading to oropharyngeal cancer, though this is rare, about 1% of cases. Prevention: the HPV vaccine, e.g. Gardasil 9, protects against high-risk strains and is recommended for ages 9 to 45. Data point: according to the CDC, HPV-related throat cancers are increasing, with oral sex identified as a key transmission route. 3. Gonorrhea details. Gonorrhea is a bacterial infection that can infect the throat, a pharyngeal gonorrhea. Genitals, or rectum. It's easily spread through oral sex, particularly from genitals to throat. Symptoms: sore throat or mild throat redness, swollen glands, often asymptomatic, especially in the throat. Complications: untreated gonorrhea can lead to joint pain, infertility, or increased HIV risk. Treatment: antibiotics, e.g., ceftriaxone, are effective, but resistance is a growing concern. Example scenario: a person with genital gonorrhea receiving oral sex can transmit the infection to their partner's throat, who may then pass it to others unknowingly. 4. Chlamydia details. Chlamydia is less commonly transmitted through oral sex, but can still infect the throat. Symptoms: mild sore throat or no symptoms, swollen lymph nodes, rara. Complications if untreated: chlamydia can cause pelvic inflammatory disease, sin in women, or infertility. Treatment: easily treated with antibiotics like azithromycin. Nota: oral chlamydia is less common, but still a risk, especially with unprotected oral sex. 5. Syphilis. Details: syphilis is a bacterial infection with rising rates, particularly among older adults and men who have sex with men. It spreads through contact with infectious sores. Chancres. Symptoms: painless sores, chancres in the mouth, gangrenous. Later stages: rash on hands, feet, fever, swollen lymph nodes. Complications: untreated syphilis can damage the heart, brain, and nerves years later. Treatment: penicillin or other antibiotics cure syphilis if caught early. Data point: the CDC reports a 70% increase in syphilis cases among adults over 50 from 2015 to 2020, partly due to unprotected oral sex. 6. HIV details. HIV transmission through oral sex is less likely but possible, especially with cuts, sores, or bleeding gums. Symptoms: early infection, fever, rash, fatigue, swollen lymph nodes. Risk factors: higher risk with ejaculation in the mouth or if other STIs are present. Management: antiretroviral therapy makes HIV manageable and undetectable but untransmittable. Reduces transmission risk to near zero. Nota: the risk is low but not negligible, especially in high-risk scenarios. 7. Hepatitis A, B, and C details. These liver-affecting viruses can spread through oral sex, particularly anilingus if for hepatitis A or exposure to bodily fluids, ETS for B and C. Symptoms: fatigue, nausea, jaundice, yelling skin eyes, dark urine, pale stool. Transmission: hepatitis A are common via oral contact. Hepatitis B spread through saliva, semen, or blood. Hepatitis C rare via oral sex but possible with blood exposure. Prevention: vaccines for A and B, no vaccine for C, but treatments exist. Key takeaway: many oral STIs are asymptomatic, making regular testing critical. A sore throat might be dismissed as a cold, but it could indicate gonorrhea, chlamydia, or syphilis. Awareness and proactive screening are your best defenses. Part 32. Understanding the risk factors of oral sex and STI transmission. What increases STI risk during oral sex? Several factors heighten the risk of contracting or transmitting an STI during oral sex. Cuts or sores, open sores, e.g., cold sores, canker sores, or bleeding gums create entry points for viruses and bacteria. Recent dental work or gum disease can also increase vulnerability. Unprotected oral sex, without condoms or dental dams, direct contact with bodily fluids or infected skin increases transmission risk. Multiple partners. More partners mean greater exposure to potential infections, especially if STI statuses are unknown. Partner's STI status. An infected partner, even if asymptomatic, can transmit STIs like herpes, HPV, or gonorrhea. Lack of testing. Without regular screening, people may carry and spread STIs unknowingly. Type of STI: high risk, herpes, gonorrhea, syphilis, HPV. Moderate risk, chlamydia, hepatitis A, B. Low but possible, HIV, hepatitis C. Why asymptomatic infections are a problem: many STIs, especially in the throat, show no symptoms. For example, oral gonorrhea may feel like a mild sore throat or nothing at all. Herpes can shed virus particles even without visible sores. HPV often has no symptoms but can lead to long-term health risks like cancer. This silent nature makes STIs easy to spread unknowingly. Emphasizing the need for routine testing, real-life scenarios, consider these common situations visible sores. Performing oral sex on a partner with a genital sore increases herpes or syphilis risk. Untreated infections. Receiving oral sex from someone with throat gonorrhea can infect your genitals. Casual encounters. Unprotected oral sex during a one-night stand carries risks, even if both partners seem healthy. Fluid exposure. Swallowing semen or vaginal fluids increases risk, especially with oral cuts or sores. Who's at risk? STIs affect all age groups. Older adults at 50+ face unique risks due to rising divorce rates and online dating, leading to more sexual activity. Lower condom use as pregnancy is less of a concern. Limited sexual health education targeting older adults. CDC data STI rates among adults over 55 have doubled in the past decade, with oral sex contributing to this trend. Key takeaways: oral sex carries real STI risks, especially without protection. Asymptomatic infections are common, making testing essential. Risk factors like sores, multiple partners, and lack of testing increase danger. Everyone, regardless of age, needs to stay informed and proactive. Part 4 of Taking Action, Prevention, Communication, and Long-Term Sexual Health Practical Prevention Strategies. You can significantly reduce your STI risk without sacrificing intimacy. Here's how. Use barrier protection, condoms, latex or polyurethane condoms for fellatio. Reduce exposure to bodily fluids. Flavored condoms enhance shushagan. Dental dams, thin sheets for cunnilingus or anilingus. Cut. Open condoms work as a DIY alternative. Availability: both are widely available at pharmacies or online, with flavored options for better experiences. Tip: even in monogamous relationships, barriers are wise if STI statuses are uncertain. Get tested regularly. Frequency: the CDC recommends annual STI screening for sexually active people, and every 3 to 6 months for those with multiple partners. Oral testing: request throat swabs for gonorrhea and chlamydia, as genital tests may miss oral infections. Benefits: early detection prevents complications and protects partners. Access: clinics, primary care providers, or at-home testing kits make screening accessible. Vaccinated HPV vaccine protects against high-risk strains causing warts and cancers, approved for ages 9 to 45. Hepatitis A and B vaccines recommended for all adults, especially those engaging in oral anal sex. Action: consult your doctor to confirm eligibility and get vaccinated. Communicate openly, discuss testing, ask partners. When were you last tested? Early in the relationship to build trust. Set boundaries. Respect preferences for using protection during oral sex. Report symptoms. Be honest about sores, rashes, or unusual symptoms to avoid transmission. Tip: frame these talks as mutual care, not accusations, to keep conversations positive. Maintain hygiene, oral hygiene, avoid brushing or flossing right before oral sex to prevent gum tears. Rinse with water or antiseptic mouthwash instead. Genital hygiene: clean genital areas gently, avoiding harsh soaps or douching, which can disrupt natural barriers. Why it matters: good hygiene reduces entry points for infections. Know when to seek help. Symptoms to watch: persistent sore throat without cold symptoms, mouth sores, rashes, or bumps, painful urination, discharge, or genital irritation, unexplained fatigue, fever, or swollen lymph nodes. Action: contact a healthcare provider promptly for testing and treatment. Early intervention prevents complications. Special considerations for older adults. Older adults at 50 face unique risks, rising rates. CDC data shows a doubling of STI rates in this group, driven by increased sexual activity and lower condom use. Stigma: many assume STIs are a young person's issue, leading to less testing and protection. Solutions: request STI tests during routine checkups, even if your doctor doesn't suggest it. Stay educated about modern sexual health practices. Use protection consistently, regardless of pregnancy concerns. Final thoughts: oral sex is a common and enjoyable part of intimacy, but it's not without risks. by understanding how STIs spread, recognizing symptoms or their absence, and taking proactive steps. You can protect yourself and your partners while maintaining a fulfilling sex life. Key actions include using condoms or dental dams consistently, testing regularly including throat-specific tests, getting vaccinated for HPV and hepatitis A/B, communicating openly and respectfully with partners, maintaining good hygiene and seeking medical help when needed. Sexual health is lifelong, and STIs don't discriminate by age or relationship status. There's no shame in prioritizing your well-being. It's a sign of strength and responsibility. Stay informed, stay safe, and enjoy intimacy with confidence. Call to action. Share this guide with someone who could benefit from it. Knowledge is power, and open conversations about sexual health can remove stigma and promote wellness for everyone.